Hi. Why would you want to consider having lab work done versus just following the metabolic assessment form guide to address the causes of your symptoms and then just purchasing the products that are designed to address those causes of the symptoms? This is a good question, and I want you to understand the reasoning behind it because you probably are used to having your lab work interpreted by your medical doctor. And unfortunately, most medical doctors use conventional values to determine if you're sick and then make their recommendations for which medications they want to prescribe to you. Now, this is the first reason. I use functional values to interpret my patient's lab work, which is much more reliable than conventional values. Generally, when you have any lab work performed, the lab will plot everyone who's been into that clinic over the past year and place their results on this bell-shaped curve. The people in the outer 2.5% are giving an H or an L for high or low, which tells the doctor that the patient is out of range and likely has an underlying disease process going on. But who typically has lab work performed? Healthy or sick people? Sick people, right? And usually people are experiencing some kind of symptoms or problems, having their condition monitored, checking on hormone imbalances and so on. And this is why so many people that have their lab work done through their medical doctor are told that everything looks normal. That's because they're being compared to the sickest of a sick population. If only 5% of the people are being flagged with problems, that's saying that the rest of our population, 95% of us, are healthy with no problems. Come on, we all know that this isn't the truth. Whereas functional values are obtained by checking a healthy population that's free from disease or symptoms, so their bell-shaped curve is much more narrow, and it helps us to catch problems with a much more sensitive scale. This is why I can find metabolic problems years before your medical doctor will be able to detect them. Secondly, you probably have overlapping symptoms. You probably noticed on some of the questions on your metabolic assessment form, they were a little monotonous, asking the same question over and over. The reason for this is that the different disease processes can produce similar symptoms. For example, low thyroid function, low adrenal function, anemia, and digestive disorders can all cause fatigue. But lab work distinguishes which organ or gland is causing the problems. This way, rather than taking support products for each of the categories that you scored high in, it narrows it down to the specific problem. This is also the reason you want to see more than just one high number in any metabolic assessment form category. The more 1s, 2s, and 3s that you have in any category, the greater the chance that there's a problem with that tissue, gland, or system. The metabolic assessment form guides help us to determine which lab work to order, so we don't order lab work on areas that don't appear to be under any stress. And finally, lab work can be done to monitor the success of a treatment program. Some people are fine with just feeling better, while others want to see it in black and white, or green, yellow, and red, knowing that a problem has been resolved. So if any of these reasons are sufficient to cause you to want to run lab work, please contact our office and we'll get you set up. Then once I get your results, I'll forward a copy to you and contact you over the phone to go over the findings with you, as well as my specific recommendations. No guessing, no trying to be your own doctor. If you'd like to learn more about a functional lab report and how you can use it to help guide your health care and purchase any of the proper supplements, please watch my video on how to use a functional lab report. Best wishes in your pursuit of health. God bless.